What is psoriasis and who gets it?
Okay. Psoriasis is one of the commonest, not commonest, but one of the common skin conditions. Is what we call an inflammatory in medicine, chronic inflammatory disease. But what does that mean? It means it's a disease that stays in you for a while, and then it has a genetic element. But what is it? What do you see on the skin? Psoriasis, normally a normal human being's skin regenerates itself every 28 days. So you will keep shedding your skin, just the way a snake does. However, it is a programmed cell death, so that it comes, grows, sheds off. So it's not the whole skin that's shedding off at the same time. Okay. But in psoriasis, that process of the cells growing is hastened so much that in 5 days, instead of 28 days, the cells have matured, which means they are immature. The growth is so hastened, they are immature, so that they don't have that program. So sometimes they even don't get out.
Yeah.
The cells are stuck together, so you get scales on your skin. We got what we call in medicine plaque. You actually get plaques on the skin. They are itchy, and psoriasis can affect anybody. It can affect any part of the body. That's why there are several types of psoriasis. Psoriasis can be classified by the part of the body that it is involved, or it can be classified by the type that it is. For example, we have scalp psoriasis, that is the psoriasis of the scalp. Then we have body psoriasis, we have nail psoriasis, and then we have joint psoriasis, psoriasis that involves the joint, and you can have psoriasis involving the private areas, what we call the inverse psoriasis. We can have psoriasis that affects children, we call it gutted psoriasis. And we can have the severe form of psoriasis, which is actually a hospital emergency, called exfoliative erythroderma, secondary to psoriasis.
Okay.
This means the whole body becomes red. It's like you have burned. Okay. And sometimes you can also have a psoriasis, but because of the treatment that you are using, it changes to a worse psoriasis called the pustular psoriasis.
And what are some of the complications of psoriasis? It seems like it's
on
a topical issue, but internally, what
yes,
can it
the first thing is, why do people come to see a doctor? They will come to see a doctor because some psoriasis are disfiguring, some psoriasis are painful, and some psoriasis can involve other body organs. One is a joint. You get psoriasis of the joint, what we call psoriatic arthropathy. And in the most recent times, from research and evidence based, we have actually seen that psoriasis now is also associated with other diseases. That's what we are calling comorbidities, such that when somebody has psoriasis, he has a higher risk of obesity.
Yeah.
He has higher risk of heart diseases, what we call the heart attacks, and this ischemic myocardial infarction, or what a layman would call a heart attack. They have a tendency to have other endocrine disorders, hormonal issues, and now, of course, we have talked about joint issues, and recently even they have eye issues and ear issues, masking. Okay. So which means that initially we thought psoriasis was just a skin problem, but now we have seen it is one of the diseases that actually now within the NCDs, the non-communicable diseases that are becoming a life challenge. Okay. And now people are taking it more serious.
Finally, in terms of the treatment and management, what is available and what are the approximate costs?
Yes, psoriasis treatment is a wide range. It starts from topical, simple things to apply when psoriasis is not severe. Then from there, it moves to things to swallow, when the psoriasis is mild and moderate, depending on how it is affecting the quality of life. And then there is also an element of phototherapy. You can actually use UV, ultraviolet rays, to actually treat the psoriasis. And now there are drugs to swallow, what we call immune suppressant, immune modulators, and of recent times now, the world has gone towards what we call biologics. Biologics are the most modern now form of treatment for psoriasis. The only problem is the cost. The cost of a product of like one of the biologics would cost maybe 1 million in a year. The dose for 1 million in a year, which is out of reach for many people.
All right, thank you.